So I'll be talking about the nodal stations in lung cancer today. Before that, I would like to clarify that the nodal stations and zones are different. So this is how it is classified into zones and stations. So zones, we have 7 zones, and in those subdivisions are like stations. So lower cervical is called supraclavicular here in stations. Superior mediastinum is divided into upper paratracheal, third zone, third station, and fourth station, that is lower paratracheal over here. Aortic is divided into 5 and 6 here, that is subaortic, paraortic. Subcarinal is same, but the zone number is here 4 and here 7 is the station number. Inferior mediastinum divided into paraesophageal and pulmonary ligament. Hilar is the same, like, but 6 here and 10th station here. Pulmonary is again like 11, 12, 13, 14 based on the lobar and segmental levels. Now let us see how anatomically it is positioned. So these are the zones. So to get it easier, you can just go craniocaudally like that. So second, craniocaudally, so from above to below. So this is zone 1. Zone 1, this is zone 2, this is zone 3, and this is zone 4, this is zone 5. So you go 1, 2, 3, 4, 5, then you come laterally. This is 6 and this is 7. Now 1 is lower cervical, also called as supraclavicular. 2, this one is superior mediastinal zone, and this one is aortic zone, and 4th is subcarinal, because here is where the trachea divides into bronchi. So this is subcarinal. And 5th is the lower mediastinal, which has the esophagus and the pulmonary ligament over here. And 6th is the hilar, where the bronchi, the primary bronchi, enters the lungs. So 6 and 6 over here, and the whole pulmonary is 7. This is 7th zone, which has lobar and segmental nodal stations. Now let us go to the stations. So lower cervical is similar to the supraclavicular here for the stations. So this one would be station 1, that is supraclavicular station. Now here again you go above to below. So I'll just tell here. So if you just zoom in, this is trachea, right? So this is upper paratracheal and this is lower paratracheal. So this is beside the trachea. Now division of this into right and left. Even the supraclavicular you can divide it into left and right, but here it is with respect to the midline of the trachea. Here is with respect to the left paratracheal border. So here this is level station 2. Here in between the upper paratracheal and lower paratracheal, what you see is station 3. Now station 3 is subdivided, I'll be telling that. So station 3 is subdivided into anterior and posterior. So this is with respect to the trachea. So trachea anteriorly is 3A, that is prevascular, in front of the vasculars, and 3P is posterior, which is back, that is retrotracheal or prevertebral, in before the vertebra or after the trachea. So third station is divided into 3A and 3B. 3A and 3P. Now this one is 4. This is 3 and this one is 4. 4 is lower paratracheal. This is upper paratracheal. Now next come like craniocaudally. So next is this one, aortic. So now aortic has 2, that is 5th is subaortic and paraortic. 5th subaortic is just below the aorta, paraortic is near the ascending aorta. So that is station 5 and station 6. Now just below, like we have completed, this is 5 and 6. Now next coming to that below one is subcarinal. This is 7. This is similar to, because the trachea divides into 2, subcarinal over here, and this one is beside the esophagus. This one is our esophagus. So beside the esophagus is paraesophageal, and this is the pulmonary ligament which attaches to the lungs both the side. So this is pulmonary ligament. So the paraesophageal is station 8, and pulmonary ligament is station 9. Now station 10. Station 10 is hilar. Hilar is where the primary bronchi enters the lung. See here you can see the primary bronchi entering the lung. So even here this one is hilar. So hilar is station 10. Now the pulmonary is divided into lobar, interlobar and all of that, right? Now here this one what you see here, this is interlobar. So between the two lobes, or like between the two lobes, this is interlobar. This station level is 11. This is lobar, this one is 12 between in the lobe, so this is 12, and this is segmental, this is 13, and this is subsegmental, this is 14. So these are all pulmonary stations. Now just like in lung cancer, how do we, these are all like from the hilar, interlobar, lobar, segmental, subsegmental or N1 nodes, and from upper paratracheal to pulmonary ligament, these are N2 nodes, and if you see supraclavicular nodes in a lung cancer patient, then it is N3. That's it.